Okay. Hey, Kenna. So I keep hearing doctors and nurses talk about dehydration and hypovolemia. I know that they're similar, but I don't think that they're the same. So can you go over with me what the difference is?
Great question. They are related, but they're definitely not the same thing. First, let's talk about dehydration. Dehydration means there is decreased water within the whole body. If you break down the word, it makes it easier to understand. The word hydration refers to water, so dehydration literally means low water in the body.
Oh, okay. So is dehydration basically when the body loses too much water?
Exactly. It usually happens with things like vomiting, diarrhea, fever, or when an animal isn't drinking enough. The body loses water from the tissues and cells. When we check for dehydration in patients, we often look for things like skin tenting, tacky or dry gums, sunken eyes. Those signs tell us the tissues are lacking water.
Okay, that makes sense. So what is hypovolemia then?
Hypovolemia means decreased circulating blood volume in the vessels. An easy way to remember it is hypovolemia equals low circulating volume. It's not about total body water, it's about the amount of fluid actually circulating within the bloodstream.
So hypovolemia is more about what's happening inside the blood vessels?
Exactly. When an animal is hypovolemic, there isn't enough fluid circulating to maintain a normal blood pressure and perfusion. You might see signs like pale gums, prolonged CRT, weak pulses, tachycardia, hypotension. These are all signs that the body isn't getting enough circulating volume.
Mm. Can dehydration cause hypovolemia?
Yes, it can. Severe dehydration can eventually lead to hypovolemia. If the body loses enough water, the bloodstream starts losing fluid too. When that happens, the circulating blood volume drops.
Mm.
Another thing that happens is that the number of red blood cells stays the same, but there's less plasma volume.
Mm.
That makes the red blood cells more concentrated. So on blood work, you may see an increased PCB.
Oh, so that's why dehydrated patients sometimes have a high PCV.
Exactly. The
Oh.
red blood cells are just more concentrated because there's less fluid in the blood.
Oh. Can a patient be hypovolemic without being dehydrated?
Yes, and that's a very important point. Patient can be hypovolemic without dehydration, especially if they've lost blood. For example, a trauma with hemorrhage, internal bleeding, surgical bleeding. In those cases, the animal's losing circulating blood volume, but the tissues themselves may still have a normal hydration.
Oh, okay. So hydration is low water in the body, and hypovolemia is low circulating blood volume.
Exactly. That's the easiest way to remember it.
Mm.
Dehydration is low water in the whole body. Hypovolemia is low circulating volume in the blood vessels. And remember, severe hydration can lead to hypovolemia, but hypovolemia can also happen without dehydration, like in cases of bleeding.
Oh, that makes more sense now. I like the trick of remembering hypovolemia as low circulating volume.
It's a helpful way to think about it, especially in emergency patients when we're deciding how aggressively to treat with fluids.
Thanks, Kenna. That really cleared things up.
Anytime. These concepts are super important in emergency medicine.
Thanks. Okay, bye, guys.